COVID is on the rise again, and with the flu season also closing in on us, some jurisdictions are mandating masking again, including Nova Scotia. As of today, masks must be worn in hospitals. CTV's Paul Hollingsworth went out to gauge reaction. And Paul, what are people saying?
Sandy, these changes are all part of an attempt to get ahead of the spread of respiratory illnesses. A partial mask mandate has returned to Nova Scotia hospitals and provincially run healthcare facilities for visitors and healthcare workers.
Anybody who's in areas, clinical areas in the hospital, so inpatient units, clinics, where we're providing direct patient care.
Infectious diseases specialist Dr. Lisa Barrett says it's all related to the latest COVID variant and alarming levels of community spread.
You don't need to look at the provincial numbers on surveillance to know that there is a lot of COVID out there.
COVID is on the rise in hospitals and communities, and not just in Nova Scotia.
Certain hospitals around the country have gone back to masking.
Dr. Barrett says even with multiple vaccine shots, the disease is still dangerous.
There are still more deaths, more hospitalizations from COVID than even from influenza.
The flu, whooping cough, and RSV spread are also causing high levels of concern. Katrina Bellavance was caught off guard when her baby contracted RSV in February 2023.
She was hospitalized for several days. And when we made the call to take her into emergency, it was because she couldn't breathe.
Bellavance applauds the return of some mask mandates, especially if it helps others be spared what her family and daughter endured.
I think that it's so important that we protect the most vulnerable around us.
These changes are new for Nova Scotia, but not for some other parts of the country, including New Brunswick. Earlier this month, masking requirements were reintroduced for healthcare workers and patients by New Brunswick's Horizon Health Network. Sandy.
CTV's Paul Hollingsworth.